If you've had COVID, even mild COVID, and you still don't feel like yourself months later, or you're living with the effects of chronic viral infection, this video is for you. Not the acute illness, but the aftermath. The brain fog that won't lift, the fatigue that doesn't make sense, the sudden difficulty finding the right words, the sleep that doesn't restore you, the anxiety and the racing heart, the feeling that something in your nervous system simply hasn't reset. What I want to show you today is that these are not imaginary symptoms, and they are not mysteries. They have a measurable neurological basis. Brainwave patterns and nervous system disruptions that researchers can now identify, characterize, and target. And they are precisely the kinds of patterns that Neurogen brain balancing is designed to address. Long COVID, or PASC, is now recognized as one of the most significant neurological public health challenges of our time. But long COVID is not unique. It belongs to a broader category of post-viral syndromes that includes myalgic encephalomyelitis and chronic fatigue syndrome, and other post-infectious neurological conditions that share the same underlying pattern of nervous system disruption. What COVID did is make these conditions visible at a scale we've never encountered before, and it accelerated the research dramatically. In this video, I want to walk through what the neuroscience actually shows, what happens in the brain after a viral event like this, and explain precisely how Neurogen's EEG-guided frequency-specific approach maps onto these patterns. Let me ground this with some numbers that make the urgency clear. More than 60% of long COVID sufferers experience persistent neurological symptoms affecting cognitive function and quality of life, even 2 to 3 years after their initial infection. About 34% of COVID survivors experience cognitive deficits lasting beyond 6 months post-infection. This was confirmed by a comprehensive meta-analysis of over 4 million individuals through 2024. And as of late 2024, long COVID affected about 18% of adults in the United States, with many of those meeting the diagnostic criteria for ME or CFS. The most commonly reported symptoms are fatigue, brain fog, cognitive dysfunction, sleep disorder, autonomic instability, including POTS or postural orthostatic tachycardia syndrome, headache, anxiety and mood disruption, and post-exertional malaise. These are neurological symptoms. They are neurological causes, and they deserve a neurologically targeted intervention. Long COVID is not a single thing, but across those experiencing it, researchers have now identified a consistent set of neurological mechanisms at work. The first is neuroinflammation. Viral infection, particularly COVID, activates immune responses that can persist long after the acute infection resolves. Neuroinflammation disrupts the normal function of brain networks, impairs neurotransmitter systems, and produces the diffuse cognitive and fatigue symptoms that characterize long COVID. PET imaging studies published in 2024 have confirmed neuroinflammation in long COVID patients. The second is autonomic nervous system dysregulation. Recent evidence has led researchers to describe long COVID as primarily an autonomic disorder, a system that regulates heart rate, blood pressure, temperature, digestion, and the stress response. The autonomic nervous system becomes dysregulated. The sympathetic branch is overactivated. Parasympathetic tone is blunted. This produces the POTS, the exercise intolerance, the racing heart, the dizziness, the fatigue that compounds even after mild activity. The third is microvascular disruption. COVID damages the blood-brain barrier and disrupts cerebrovascular reactivity, reducing cerebral blood flow in certain brain areas and producing the hypometabolism that's visible on imaging of the frontal, temporal, and parietal lobes. The fourth is direct network disruption. Neurophysiological studies confirm underactivity in specific brain networks, particularly the prefrontal cortex and its connections, and disrupted network coherence between brain areas responsible for attention, executive function, and memory consolidation. Together, these mechanisms produce a brain that is inflamed, autonomically dysregulated, and neurophysiologically disrupted. And all of this is measurable on EEG. This is the core of what I want to establish, because this is where the research becomes most specific and most actionable. Long COVID and post-viral symptoms produce measurable, replicable EEG signatures. These aren't hypothetical, they have now been characterized in multiple independent research groups. The most consistent finding is reduced posterior alpha power. A landmark 2024 study published in Alzheimer's and Dementia reviewed EEG across long COVID patients and found significantly reduced resting state alpha rhythm activity. The 8 to 12 Hz oscillation associated with cognitive readiness, attention regulation, and vigilance. This reduction was more pronounced in patients with greater fatigue burden and correlates directly with a subjective experience of brain fog. It mirrors the alpha reduction seen in mild cognitive impairment, which is precisely why researchers are now describing long COVID's cognitive effects as overlapping with early neurodegenerative patterns. The second signature is elevated slow wave activity. There's an increase in delta and theta power across the cortex that reflects a disrupted cortical processing in a brain struggling to sustain organized activity. This diffuse slowing is one of the most robust EEG findings across neurological insults. It appears in long COVID EEG at rates that correspond to the severity of cognitive and fatigue symptoms. Third, there's altered EEG coherence. A 2025 study found reduced P300 amplitude and altered EEG coherence in long COVID patients, objective markers of disrupted information processing and impaired network communication. Critically, these biomarker changes normalized as people recovered, confirming that they reflect the active neurophysiological disruption, not a fixed deficit. Fourth, cortical hyperexcitability. Elevated high beta activity reflecting an over-aroused nervous system appears in the anxiety, hypervigilance, and sensory sensitivity that many long COVID patients describe. This is the same pattern seen in anxiety disorders and in post-concussion syndrome. And fifth, disrupted sleep EEG architecture. Abnormal sleep spindle density, reduced slow wave sleep, fragmented sleep architecture, which reflects and perpetuates the systemic neurological disruption. Poor sleep amplifies neuroinflammation. It impairs lymphatic clearance of neural debris, and it compounds cognitive dysfunction in a self-perpetuating loop. Every one of these patterns is a Neurogen target. I want to spend a moment on the broader category that this belongs to, because the implications extend well beyond just COVID. ME and CFS, myalgic encephalomyelitis, and chronic fatigue syndrome, has been documented for decades as a post-viral condition. Historically dismissed as psychosomatic, it's now understood as a genuine neurophysiological disorder with measurable brain and autonomic abnormalities. The EEG signatures show reduced alpha, elevated theta, disrupted coherence, and abnormal sleep architecture are substantially overlapping with what we now see in long COVID. They share the same core pathophysiological mechanisms of neuroinflammation, autonomic dysregulation, and cortical network disruption. What we now know about post-viral brain disruption applies across the spectrum: long COVID, chronic fatigue, post-Lyme neurological syndrome, post-Epstein-Barr syndrome, and other viral sequelae. The oscillatory disruptions are the common denominator, and the passive EEG-guided neuromodulation that Neurogen delivers is particularly suited to this population, precisely because the passive protocol requires nothing from a patient whose core problem is that their brain is exhausted. Neurogen brain balancing is described in the peer-reviewed literature as a novel, passive, non-invasive neurobiomodulation modality for brain health. For those experiencing long COVID and post-viral symptoms, 4 features define its relevance. First, it's fully passive. There is no task to perform, no screen to watch, and no cognitive load to sustain. Clients come in and rest, and this is clinically essential for a population defined by post-exertional malaise. Active interventions like cognitive training and active neurofeedback risk triggering things getting worse in chronic fatigue and long COVID sufferers who are sensitive to exertion of any kind. Neurogen removes this risk entirely. The brain receives the reference signal at rest without being asked to perform. Second, real-time EEG guidance means that every session is individually calibrated to what that person's brain is actually doing in that moment. Long COVID sufferers vary significantly in their EEG profile. The pattern of alpha suppression, low wave elevation, coherence disruption, and arousal. A protocol generated from live brainwave data addresses the actual neurophysiological state, not a generic approximation of it. Third, lip test, low intensity pulse transcranial electrical stimulation. places Neurogen in the same class as transcranial direct current stimulation, which has been studied specifically in long COVID. A 2025 randomized trial published in Scientific Reports studied transcranial direct current stimulation combined with cognitive training in long COVID patients and documented meaningful improvement in fatigue and cognitive function. A case study published in Psychiatry Research Case Reports documented increased theta, alpha, and beta power and decreased pathological delta power following TDCS augmented rehabilitation in a long COVID brain fog patient, the exact oscillatory normalization that Neurogen is designed to support. And fourth, EEG-guided neurofeedback targeting long COVID brain fog has demonstrated direct clinical benefit. A case study published in 2024 showed that neurofeedback in a long COVID brain fog patient produced increased alpha power at almost all sites, decreased high beta at all sites, and significant subjective cognitive improvement across 15 sessions. A 2025 follow-up secondary analysis confirmed the pattern. Quantitative EEG-guided neurofeedback modulates the specific frequency disruptions of long COVID brain fog toward a more organized, coherent oscillatory state. Let's directly map the EEG evidence to the intervention. Lower posterior alpha, the signature of brain fog, impaired cognitive readiness, and the loss of the attentional regulation that makes thinking fluid and effortless, is addressed through EEG-guided protocols that support restoration of alpha power in posterior and frontal regions. The neurofeedback case evidence confirms that alpha restoration correlates directly with cognitive improvement. Elevated slow wave activity, the delta and theta overdrive that reflects disrupted cortical processing, is targeted through the Neurogen signaling, using the same mechanism documented in the MEG study of acquired brain injury, for the reduction of pathological slow wave burden with corresponding functional improvements. With disrupted coherence and reduced P300, the impaired network communication that produces the processing slowness, difficulty with word finding, and working memory failures of brain fog, is supported through Neurogen's influence on network connectivity and oscillatory synchrony. Cortical hyperexcitability and high beta arousal, the anxiety, hypervigilance, and the sensory sensitivity respond to the same mechanism that Neurogen deploys in anxiety and PTSD by reducing pathological beta overactivation and restoring inhibitory alpha rhythms. Autonomic nervous system dysregulation, the sympathetic overdrive that underlies POTS, exercise intolerance, fatigue, and the inability to restore baseline after exertion, is addressed through vagal modulation, promoting parasympathetic dominance. This is particularly significant because autonomic rebalancing is increasingly understood as foundational to long COVID recovery. And disrupted sleep architecture, the non-restorative sleep that compounds every other symptom, responds to the same cortical downregulation mechanism, supporting the shift toward deep, slow-wave sleep and the glymphatic clearance that is essential for neuroinflammatory recovery. The brainwave disruptions of post-viral neurological syndrome are measurable. They correspond to symptoms, they respond to EEG-guided and transcranial electrical stimulation-based interventions, and they are precisely the targets of Neurogen's protocol. Strong candidates for Neurogen post-viral protocol include anyone experiencing persistent symptoms following COVID-19 or another viral illness, at any point in recovery from months to years after the initial infection. Brain fog, cognitive slowing, and difficulty concentrating, with or without formal neurophysiological test abnormalities, persistent fatigue and post-exertional malaise, sleep disturbance and non-restorative sleep, autonomic symptoms including POTS, exercise intolerance, and dysregulation of heart rate and blood pressure, anxiety, mood disruption, and hypervigilance, chronic fatigue syndrome diagnoses, whether preceded by COVID or other viral illnesses, headache, sensory sensitivity, and the broad dysregulation that defines this population. Some important considerations. Neurogen is not a cure for long COVID, and it is not a replacement for medical evaluation, management of specific conditions like POTS, or other evidence-based supportive care. It's a powerful complement, addressing the underlying oscillatory and autonomic dysregulation that drives the neurological symptom burden, alongside whatever broader care the patient is receiving. For clients with post-exertional malaise, the fully passive protocol is specifically appropriate. There's no exertion required, and sessions can be paced to individual tolerance. Long COVID is a neurological condition. It has measurable EEG signatures, and those signatures can be targeted. The reduced alpha that produces brain fog, the slow wave overdrive that disrupts cortical processing, the broken coherence that impairs network communication, the autonomic storm that prevents recovery. These are not permanent features of a damaged brain. They are dynamic, oscillatory states that can shift. And we now have direct evidence that EEG-guided neuromodulation can shift them. If you are living with long COVID, chronic fatigue syndrome, or the aftermath of another viral illness, and you have been told that your symptoms are not measurable or not treatable, I want you to know that the neuroscience has moved far beyond that. To learn more about our integrative neurorehabilitation practice and to schedule a consultation, visit acuneuromodulation.com. For veterans, 4 free sessions are available through the nonprofit bb4vets.org. We are here to help.